2-3 doctoral degrees, not because I'm that savant or I'm just a nerd, and I really enjoy learning and I love helping people. And so technology is constantly changing, and we had this technological, biological evolution in the two are meeting, and I don't want to wait 20 years before the rest of the times catch up with what can be done as far as regenerative medicine. So tonight we're going to talk about what is regenerative medicine, what is stem cell therapy, or what the technical term is called biological allograft. What are these things all about? What are the do's and don'ts, and where's the science, and how can it help people? So the first thing that we have to understand is that the power that made the body heals the body. The body has healing capabilities within itself all the time. You know, if you look at the fact that we're always regenerating, when we're regenerating, we look at our stomach cells regenerate every, 5 days, right? So if someone gets an ulcer, it can regenerate very quickly. We look at the skin cells. When you cut yourself, Neosporin, and you see the commercials, they're like, look at it after a week. Guess what? It's going to heal in a week anyways. It might keep it moist to make it look a little bit better, but our skin is always regenerating. Our red blood cells regenerate every 4 months. Our liver cells, you can take out the majority of the liver and have a full functioning liver again, and it regenerates about every 5 months. And then skeletal bones completely repair or completely regenerate in about 10 years. So then the question becomes, well, doc, if all these things are regenerating, how come I feel like I don't feel good? How come I hurt? How come my body is aching? And the reality is because our body essentially starts breaking down faster than we're building up. When we're children, we're constantly in that growth phase. So if we look at the time that, somewhere in our mid-20s, that we usually start to go on the decline and our body's not repairing as fast as it's building up anymore. So part of medicine that I'm part of as well, I just actually came from Bronson Hospital. That's where I work at in Kalamazoo, and then my private practice is in Holland, Michigan. But it's if-then medicine, which is traditional medicine, and basically it's if-then. If you have pain, let's give you a pain pill. If you're depressed, let's give you a happy pill. You know, if you have a nail on the bottom of your shoe, does it make sense if I say, hey, I'm going to inject your foot with lidocaine, I'm going to numb the nerve up, when it wears off, just come back? Does that make sense? No, what would you want me to do with that nail? Maybe pull it out, right? So let's pull the nail out. Why? Because that's the cause of your pain. It's not a lidocaine deficiency. It's not because you don't have enough pain medication that you have pain in your foot. No, there's a nail there. So let's figure it out. But that's what if-then medicine does a lot of the time. So typically when you have osteoarthritis, some of the things that we deal with, I think this thing shines on the TV screen, it doesn't. So what do we focus on? You know, people come in with pain. They got osteoarthritis. Osteoarthritis is a chronic, progressive, inflammatory disease. What does it mean? Is that it's not something that acutely happens and it goes away, like the flu. You know, you get the flu, you're going to be sick for 5-7 days, and then it goes away. You know, that's an acute illness. This is something that's chronic. It progresses over time. It's inflammatory, which means it's like on fire, and it's constantly hurting. And it continues to snowball, and it progresses and goes the wrong way. So what we do is really you're given the option of drugs, which what drugs we typically give is 65% of people get NSAIDs, which is ibuprofen, Tylenol, Mobic, all these different types of things to help control inflammation. But does it fix the problem? No. When I do sports medicine at Western Michigan University, one of the things that we tell people, specifically the high-end athletes, is that if you roll your ankle, you hurt your tendon or anything, don't take ibuprofen. Don't take those. Why? Because they inhibit the healing process. They actually slow down healing. While it may take inflammation out, it actually slows down healing. So the other thing in medicine that we do is when the patient fails that, we typically say, okay, let's give you steroids. So we're going to inject your knee with steroids. The problem with steroids is it also inhibits the healing process. It also demineralizes your bone and takes bone out, so we can't give an injection more than 3 times in one site, typically, because it shows it causes osteoporosis, which is thinning of your bone, because it has side effects. Every drug has a side effect. And then after that, there's also Synvis, which is like, it's kind of like oil for your car engine. You know, it kind of lubes up the joint, if you will. It comes from roosters, from the comb of it, and it's kind of the gelatin type thing. So some people, one of the old treatments that people do as a home remedy is Knox gelatin, because of the gelatin component of it has been shown beneficial, but we inject it into the knees, but it's only transient. Once the body absorbs it, you're done, that's it. No healing really took place, it just lubricated. It's like spraying WD-40 in the area. After that, then you're getting surgery. If you tear a meniscus, we go in there and clean the meniscus out in your knee. which will lead to more osteoarthritis and degeneration. If not, the other option is that we actually go in there and do a knee replacement. Once you do a knee replacement, you lose a lot of the different architecture of your knee, which eventually lead to your hip issues, knee issues, so on and so forth, and ankle issues. So that's what we do with if-then medicine. The other types of medicine there are mind-body medicine. So mind-body medicine is, think of, has anybody ever been in an argument with somebody? Right? Okay. So what happened in that time frame? Maybe your heart started beating a little bit faster, your muscles tense up. If we were to check your blood pressure would go up. Are you sick? No. That was emotion, that was anger or fear, whatever it was. And so it was a thought process that created a chemical change in your body that released stress hormones that caused your heart rate to go up. No different than when you're on a treadmill running. If you're on a treadmill running, or you go down the street to go run, what happens? Your heart starts beating faster, your blood pressure goes up. Are you sick? No, your body's adapted to that physical stress you put it under. Chronic pain is a physical stress. Sometimes people's blood pressure goes up. Sometimes people's emotional levels are so high that they have high blood pressure because their bodies are releasing all these stress hormones. But what do? We just give them a blood pressure lowering medication instead of figuring out what actually causes it to go up in the first place. Is it chronic pain? Is it emotional stress? Is it chemical stress or physical stress? It's a combination of all that. So that's mind-body medicine, is that our mind does control our physiology, and it's important. And that's where people talk about, in medicine now, people are talking about gratitude and being thankful for the things that we have. What a thought. Be grateful for what you have. It makes the body go work a lot better. Lifestyle medicine is all about the foods you eat, the thoughts you think, the exercise that you get or don't get. So when you think about that, our body is made up to run off of vitamins, minerals, proteins, fats, and carbohydrates. And the last thing is water. Right? So I find it very interesting that Earth is 70% water, and if you look at it biblically, it says we came from the Earth and we're 70% water. Interesting thought. Anyways, moving on. But if we look at that, 80%, it's actually 82% of deaths in America are related to poor dietary choices, physical activity, smoking, or not getting your proper screenings. Those are all choices, right? You choose to eat well, you choose to exercise, you choose to get screenings, you choose not to smoke. So the top causes of death are by choices. So lifestyle medicine is about preventing those things and not just succumbing to the idea that, oh my goodness, I'm just going to die of this, I'm going to get diabetes because my mom had diabetes, my dad had diabetes. Well, maybe it was the environment, you adapted the exact same lifestyle that they did. That's lifestyle medicine. I will never, no matter what, genetically, I will never be a 6'10" basketball player. No matter how I eat, no matter how I exercise, it's just not in my genes. Each of us is a different person. So as different as Jeff and I will look, our body works that differently on the inside. And the reality is that it's going to function in how we treat it. And that's where lifestyle medicine comes in. And part of that lifestyle medicine is, again, the physical activity, standing, walking, exercise, getting the proper adjustments, making sure that your spine is moving right, that your other joints are moving properly, so you can maintain your physical activity. And the last one is regenerative medicine. Regenerative medicine is on the forthcoming because we know the other aspect of this-then medicine is not really working for us as far as longevity. We're living longer, but we're not living better quality of life, and there's a big difference. So regenerative medicine is really what I focus on, and that's where a lot of my research mind comes from in the PhD, because I really wanted to understand what are some of the best treatments that we have available for us to use to help people get better, and not just numb them up with lidocaine because they got a nail in the bottom of the foot. You know what I mean? Any questions on that? All right, so let's dive into exactly what is a stem cell. A stem cell is a cell. So if we look at if we take one cell out of your fingernail, and we take a cell out of your eyeball, and we take one out of the bone in your toe, and if I take one out of your heart, that cell has all the same DNA, the exact same book of information inside that cell. And it all started with one cell. When the sperm met the egg, that DNA fused, and then all of a sudden when it started replicating, it started becoming a nail, a tooth, an eyeball, a toe. So one cell, and that's what we call pluripotent, meaning that one cell could become anything. It could become anything in your body because it has that DNA, that book, that instruction manual, if you will, of everything. It's like a dictionary. It's got every word in there. and it can become anything it wants to. The environment changes what it can become. So when you talk about stem cells, embryonic stem cells is what comes from fetal tissue, okay? And that's where all the discrepancy comes when people talk about stem cells and stem cells are illegal, that type of thing. That's fetuses. That's where those types of cells, because those cells haven't really differentiated yet. So what we're talking about is a multipotent stem cell, which is called a mesenchymal stem cell. This is a stem cell that's already been differentiated to become fat, cartilage, bone, muscle. It's not going to become something. It's not going to become your heart tissue. And actually, what we're talking about is these mesenchymal stem cells just become this line of connective tissue, and that's really what the mesenchymal stem cells are about. So, how do they work? Well, in our own body, when we all have our own mesenchymal stem cells. We have hematopoietic stem cells, which means we have stem cells that become blood tissue. So, have anybody ever heard of anybody getting a bone marrow transplant? Okay. So, a bone marrow transplant, inside of our bone, we have this cavity in the middle of it that has this matrix of stem cells that are blood-borne. So, we can extract that and give it to someone else to help their body use those stem cells to recreate new blood because their body has failed. Something in their body went wrong and they no longer can make their own red blood cells effectively, or white blood cells, whatever the situation is. So we know we've been doing that for years. Since at least the 60s, we've been doing bone marrow transplants. So, but what we're talking about today is umbilical cord tissue and umbilical cord stem cells. And those stem cells, the mesenchymal stem cells, don't come in. I don't inject something into you and it becomes your new tissue. It goes into these areas of damage and it gives out signals of healing. And it tells your own stem cells, your own mesenchymal stem cells, it says, it's like the foreman. It kind of slaps them around and says, hey guys, get to work. Lunch break is over. And it gets everybody together to go to that area and create the healing process. So it starts to put the fire out. But let me ask you, can you remodel a house if it's on fire? Not a good idea to go into a blazing house, right, when it's on fire. You can't really remodel. Same thing when we have osteoarthritis. Osteoarthritis, I said earlier, is a progressive inflammatory reaction. Inflammation is analogous to the fire of your house, okay? So you can't go in there and remodel that knee and allow healing to occur until that fire is dampened and the fire is put out. So that's what these mesenchymal stem cells do. They go in there, they put the fire out, and then they start being able to go in there and they call in other tissues. So they call in other workers. If your house is on fire, you call 911. Fire department comes with their axes and hoses, they spray the house down, they bust in your doors with their axes, and they save your home, they save your life, everybody's happy, right? Well, Monday morning, who do you call? Do you call the fire department to come remodel your house? No, you call in a different set of people with different tools, right? Someone that has more tools on their tool bag. And that's what these mesenchymal stem cells do, is they're standing there calling in the different people that put the fire out, and then they're calling in the other people to come in there and start the rebuilding process. So I mentioned earlier that we break down faster than we build up. So if we look, when we're a newborn baby, 1 in 10,000 cells is a stem cell. All right? By the time we're 80, it's 1 in 2 million. So what's that done to your stem cells? They've significantly declined. And we all know, when you're 5, you can take a tumble and you can keep on kicking and ticking, right? You can get on, when I was in 5th grade, I get on my bicycle, I ride 5 miles, I go to my friend's house, sleep on his floor without a pillow, wake up the next day, go do it again, play football, basketball, do all those things, sleep on his floor, go ride my bike 5 more miles. I would go home periodically as a kid, I promise. But the reality is, now I go sleep in a hotel, I'm worried about what pillow I'm sleeping on, because I don't want to wake up with a stiff neck and it's going to be there for 3 weeks. Because if we look at that, by the time we're teenagers, the stem cells significantly decline. When you're a teenager, it's 1 in 100,000, from 1 in 10,000. So you take 10,000 cells, 1's a stem cell. If you take 2 million cells, by the time we're 80, only 1 is a stem cell. When we're 30, it's 1 in 250. And it just continues to decline as we age. So we know that the stem cells decline as we age, so meaning we're not going to be able to have enough people around to build up effectively. On top of that, is that when we're a newborn, if you look at all those cells, when they replicate, each one replicates on average every 22 hours, between 20 to 24 hours, when it's newborn tissue. By the time we're adults, it's every 48 hours. By the time we're 65, it's much slower. It's every 60 hours. So what does that mean, every 60 hours? What that turns into is when you're a newborn, when that one stem cell replicates, 1 becomes 2, 2, 4, 4, 8, 8, 16, 32, 64, so on and so forth, right? 128, you keep going. It replicates like that. At that rate, in 1 month, one stem cell is going to be 1 billion cells. If you take it from someone 65 or older, because it replicates every 60, you take one stem cell, 1 becomes 2, 2, 4, 6, or 2, 4, 8, and 16, 32. You only have 200 cells in a month's time. So we have less of them, and they replicate much slower. So that's why, as our body turns over, we don't feel better. We're not healing better. It also becomes what we're putting into our body. The important thing also is to consider that if a barn gets blown over with a tornado, do you go back and rebuild it with that same material? No, you get new material and you start rebuilding. So you have to ask yourself, what am I feeding myself on a daily basis that's going to help my body heal and recover appropriately? When it comes to stem cells, there's over 4,000 different clinical trials going on right now. It's booming. Why? Because we know this is where it's going. When I had my first son 16 years ago, they asked me if we wanted to store his umbilical cord blood in his tissue. And we said, no, I don't know why we would need that. Well, guess what? I've learned a little bit as I went back to school. Now I wish I would have, because we knew the regenerative properties of it, we just didn't know where the science was going. And now we're learning more and more every day, so much so that we got over 4,000 studies going on right now. When I look at the science, when I look at the research, I put my research hat on, and I have some questions that I want to answer. And I want to know, what's it most effective for? What I can say with clarity is that what I see is that it's most effective for, without question, is musculoskeletal concerns. Being a chiropractor, doing sports medicine, I'm interested in that because I know it's something that chronically plagues people. You know, as a primary care physician doing family medicine, it's 80% of what people come in with is musculoskeletal concerns. I didn't want to just say, take ibuprofen, and then when you get done with that, okay, let me give you a steroid shot. Okay, after that, let's replace your knee. Let's replace this. I didn't want that life. That's not what I got into this for. I got into this to be a game changer and to help more people and help you live a better, more fulfilling life. Because you know, it's hard to fulfill your purpose if you're fatigued, depressed, and falling ill with chronic lifestyle diseases, right? It's hard to do it if you're chronically in pain. How can you go help your neighbor if it's hard for you to walk or you just can't even bend over? So, as I mentioned, to chronic progressive disease, it's going to affect 130 million people by 2050. It's the 5th leading cause of disability in the world right now. It costs $80 billion per year in losses in wages. In the United States, 65% of people are given NSAIDs. And if you look at this, what's a total knee replacement cost? We're talking $20,293. And it's going to last 10 years, maybe 15. Technology is getting a little bit better. And then the repeat costs $26,383 and $88. So that's what we're looking at. It doesn't make sense to me. If we look at this case study, so there's a case study of 339 patients. All these patients qualify for a knee replacement. So what they end up doing is, instead of doing a knee replacement, 69% of them opted to have their knees injected with stem cells. The type of stem cells I'm talking about. And at 1 year, only 6.9% went on to have the knee replacement. The others were satisfied with their pain, their increased mobility, and how their body was overall functioning with this. So my question, and this is all the way back in 2011, so this is 8 years ago. My question is, that's 90% effectiveness. But my research hat says, well, what was it after a year? How are they doing 2 years out? Are they still doing good 3 years out? 4 years out? I don't know. We've only been able to do the stem cell therapies in the United States for about 6 years. And the data is, we don't have all that data. But I can tell you that we've got lots of people that have been getting better with this type of therapy. Let's see. Well, if you look at knee replacements, 223 patients, the average cost, if you look at the other spectrum of it, is $40,000 to $70,000 getting both done. If you look on average, 17 to 23 will suffer serious surgical complications such as infection. 1 to 2 will pass away. 1 to 2 will get a pulmonary embolism because they get a blood clot because they're not moving due to their leg. 1 to 2 will get a heart attack. 11 to 14 will require readmission due to the infection. If you look at the stem cell therapy, average cost, in 223 patients, $15,000 to $17,000. No significant complications. 90% of the patients had 50% improvement or better, and 50% had greater than 75% relief. So that's a big difference. Minimal side effects, increase, and people are happy with this. People are doing well with it. So here's an image of a before and after. I work with Neil Reardon, and Neil is one of the top foremost researchers in stem cell therapy. If you ever hear of anybody and you look it up and you check it out the internet and you hear about Panama, Neil Reardon is one that goes, he's the one that started all the clinic down in Panama. That's where people fly to. Why? Because he can do things there that we can't do in the United States. I can only really treat musculoskeletal conditions in the United States. But here's an image from their institute where this is torn cartilage inside the knee. And if you look at this is 12 weeks after. So you can actually see, it almost looks like putting spackling on drywall. If I were to put a hole in here and put spackling on there, you can see how it just healed over in there. Typically in medicine, what do? We go in there and shave this off so it's a more smooth surface. But if I shave it off, what's that doing to the height of it? It's making it smaller. You make it smaller, what's that create? Osteoarthritis. Does it make sense? This is looking at a before and after MRI in the knee. So if you look here, here's the knee here, and you can see the spacing. So if you look at this distance, you want to be able to see the darkness on both sides and a nice thickness in the middle of it. And here, if you look at the spacing here versus here, this is after. This is 5 months after the injection. We have a 75% increase in the cartilage of the knee itself. That's impressive. Nothing else in medicine does this. Nothing else. So that's before and after on the knee after 5 months. So this is another image. So one of the things that people use this for is neuropathy. Anybody know what neuropathy is? So neuropathy is